The very first question I always get at a lot of my primary care visits is, do I need routine labs drawn, this visit, Dr. Tam? I just want to debunk and break down the primary care visit from my lens as a primary care physician. All right, hi mighty family. This is Dr. Tam checking in today, and I just want to debunk and break down the primary care visit from my lens as a primary care physician. So I hope you guys have been enjoying these debunk segments. It's been a lot of fun for me, and I hope I'm bringing up a topic that is of interest to you all. So really the reason for this segment in particular is, too often I feel patients leave their doctor's visits feeling like they're not getting everything they had hoped for out of the visit. And honestly, sometimes I feel that way too as the doctor. There's moments where I felt if I had a little more time, I could do a little more. Or, if there was a little more time, we could have just chit-chatted and got to know each other a little more. But all to say, I think that relationship is special, but it does take some understanding on both ends to really optimize each visit to make sure, we're helping you stay on top of your care and that you're also in the know as to what needs to be done. So the very first question I always get at a lot of my primary care visits is, do I need routine labs drawn, this visit, Dr. Tam? And I think, that is so important because everyone that wants to be healthy wants to stay on top of their health by knowing if their lab values are improving. But actually, the short answer to this question is, we usually don't need routine lab draws unless we're changing medications. So I want to really break it down by kind of the most common diseases that I've seen. So diabetes, hypertension, cholesterol. And so in regards to diabetes, the lab value that we usually check is the hemoglobin A1C. This is basically an average blood sugar for the past 3 months. Okay, so unless I'm actively changing your diabetes medication and assessing for its efficacy, I usually wouldn't check it every 3 months and instead will move closer to every 6 months to a year. And in regard to cholesterol, as you guys all know, that's usually the lipid panel. So with the lipid panel, that's kind of more of a check to make sure the medications are working. So if you're in a place where you have just started a statin, we then want to shortly check your blood work after that to make sure the statin is effective. However, after that initial check, it's really more of a yearly screen. And then lastly, in terms of blood pressure. So the main reason we check lab work for blood pressure is to check if your blood pressure medications are causing any electrolyte imbalances. So as you know, for blood pressure, there's, water pills and things of that nature. And oftentimes that can drive some of your potassium down. So we want to make sure that after starting a medication, your electrolytes are balanced and that we don't need to worry about anything in particular. So usually if your body's tolerating these medications well, there's really no need to be checking them very often. So really the main takeaway here is this: frequent lab draws are often not necessary. We never want to take any precious blood away unless it's absolutely going to change the management of our medical conditions, okay? All right, so let me break down the next topic of interest. And really that's just, something that's not talked about enough in older adults, and that's vaccines. So we all know during childhood, we have very strict, vaccination regimen to follow. But I feel in older adults, oftentimes in our primary care visits, we don't emphasize the importance of them enough, but rather we don't really talk about the older adult vaccine schedule because technically there is one. Okay, so with COVID-19 and the flu, we already know how important both those vaccines are. So I don't want to belabor the point on that. Today, instead, I want to focus on 3 main ones that you should be getting and asking your primary care doctors about. So the first is the Zoster Vaccine. So this is to prevent against the dreaded shingles, okay, that I'm sure you've had some friends have, which is an extremely painful skin rash that usually manifests in a group of blisters, generally on one side of our bodies. So the older we get, the more susceptible we are to getting this as our immune system decreases, okay? So once you're 50 years or older, it's highly recommended that you get this vaccine, and it's often done in 2 doses with about 2 to 6 months apart. The only reason you should not get this vaccine is if you have a severe allergic reaction to the first dose. All right, so the next vaccine I want to talk about is the pneumococcal vaccine. So the goal of this vaccine is to protect you from a bacteria that is very commonly causes pneumonia and sometimes even widespread infections. Okay, so if you have underlying disease that causes you to be immunocompromised, such as diabetes, chronic kidney disease, you should receive your first dose of the vaccine prior to 65 years old. And if you have no medical conditions, you should ask your doctor about this vaccine once you turn 65. So you may think, well, this may not happen to me, but it's actually very, very common. So just last night, I actually got off a night shift, working as a hospitalist, and lo and behold, I had a 71-year-old gentleman come in with a raging, pneumonia that we had to, treat expeditiously to stabilize. So it's not uncommon, and it's something that actually happens very frequently. All right, so the last vaccine I want to mention is your tetanus, diphtheria, and pertussis vaccine. And I'm sure most of you have gotten this vaccine before, but this is one vaccine that should really be updated every 10 years. And more so for those that are becoming grandparents, as soon as there's a newborn in the picture, it's so important to get this updated as well, because it protects you from bacteria that can cause very serious infections. And the most commonly one we think about is tetanus, right? In terms of when we step on a rusted nail, and develop a severe foot infection. I recently had a colleague who both of their kids actually were just playing in a neighbor's backyard and caught tetanus. And it's one of those things we don't see often, but when infected, it can be very, very severe and life-threatening. So it makes it that much more important to not just protect yourself, but your loved ones as well, okay? All right, so I hope this offers some clarity on which vaccines to get as an older adult, as well as why they're so important, okay? So the last question I want to debunk and really knock out of the park is the question of, should I be seeing my primary care provider even when I don't have any issues going on in my life? So this is kind of a classic example, something my dad brings up to me all the time. I've been nagging him to go see his primary care doctor for years, and I think he only recently done it 2 weeks ago. And it's just natural. When we feel fine and we're able to do all the things we normally do, oftentimes we don't think to go see our primary care doctors because we feel fine. But as a primary care doctor, really the best type of healthcare I can provide to someone is preventative healthcare. And so we think about, our colon cancer screening, our breast cancer screening, our lung cancer screening, our cervical cancer screening. Those things are oftentimes the most gratifying parts of my job, because if we're able to catch something early and get it treated, we've effectively saved someone from a very poor prognosis, right? And so, I just wanted to really call it out and just put that reminder out to everyone here today. And that's really just stay on top of that healthcare maintenance. So really, as you come to a primary care doctor, in my mind already, I kind of already have a checklist of things I need to do. For example, I'll think, all right, Barbara just had her breast cancer screening a little over 2 years ago. She's due for that. She just had her colon cancer screening, yearly. She's doing a fit test. It's time for her to get another one. And it's like, okay, she's approaching 65. Should I start thinking about a DEXA scan? So those are the things that are running in my mind, as I see patients for routine visits. And those are the things that you should also be thinking about too. It's like, hey, wait, did my doctor offer me this vaccine, or did my doctor offer me this colon cancer screening? I should follow up on that, And I think if we can both do that, there's very little chance that we'll miss something that will be so crucial to maintaining your health. All right, so hopefully I didn't belabor that point, but it's just something that I'm really passionate about and just really want to focus on preventative care, because I think we as society are constantly playing catch up, putting band-aids on problems. But if we can really get to the root of it, I think that's when really, really amazing health begins. All right, Mighty Family, that's all I got for today. I hope this session was able to answer some common questions about your visit to your primary care doctor. I'm happy to stay on for a little bit and just take more questions and give you my perspective on anything you're interested in.